Hi, my name is Dr. Stephen Mullen. This is a patient of mine that came in here, what, 2 weeks ago?
Last week.
Last week. And you were
It's my
involved
third
in a
session.
fairly serious automobile accident, is that correct?
Mm-hmm.
And since that accident, you've been having some serious issues with sleep, with back pain, neck pain, um, emotional stuff going on with you, and multiple symptoms, haven't you?
Yes.
And so he had an MRI of his neck, and we actually have looked at it, and he's got quite an instability in his neck. But what we're looking at here is what this is actually creating and causing for this gentleman, and it's something that needs to be looked at, or otherwise you could miss it. When he's standing here just like this, he looks very stable. And the reason we have this on his neck is because he does have some instabilities. Can you take that off for me right now? So his proprioceptiveness is not functioning right. His dorsal columns are being compressed. And you'll see what we're going to have happen here is he's falling back a little bit, but arch your neck back a little bit. And we'll see how it just creates more of an instability. So he's really rocking now as soon as he puts more extension in his neck, which is compressing the cord, and it's actually creating improper proprioceptive messages being sent back to his brain. Now bring your head forward like this. And when we take the pressure off the cord there, you can see that he becomes more stable. This is also going to weaken his descending motor tracts, and he's going to get weakness in his legs. And we're going to show that. We're going to have him lie on the table here for a second. So would you lie down here for me real quick? So we want to take pressure off the cord. So we're just going to have you bring your chin towards your chest. And I'm going to test this leg. Bring it up for me. Push up towards the ceiling. That feels fairly strong, doesn't it? Bring this one up. Push up towards the ceiling. As soon as we put an extension in his neck, which is putting compression onto that cord and compromising some of the ascending and descending tracts, hold this leg up. Bring this up. Push up towards the ceiling. Now you can't hold it at all, can you?
No.
Yeah, it hurts. My point being here is that before any type of techniques or any type of procedures are being done, you have to really look at the neurological aspect of the patient and look at the tracts and what's happening, because with this gentleman, obviously his dorsal columns are being affected and his corticospinal tract because his muscles are weakening. And so if you went in and tried to do some type of cervical adjustment on this gentleman, it could have some serious outcomes. Thank you.